this lecture regarding case history about a patient, young male patient presenting with shortness of breath, chest pain, and rapid heart rate. We have so far discussed about the ECG findings and X-ray findings of this patient. Now the next question is, given the history, which sinister condition needs to be excluded? By sinister I mean a condition which is life-threatening, that should be on the top list of our differential diagnosis, and if it's not treated can lead to life-threatening condition or may lead to patient's death. So given this history and the clinical examination and the complaint symptoms of the patient, it is important to exclude pneumothorax. Since a tall man presenting with shortness of breath and chest pain, there is increased incidence of pneumothorax in tall individuals. Hence it is important that we should exclude this. A chest X-ray was done and it did not show any findings of pneumothorax, which would be indicated by absence of lung markings on the lung fields and dark lung fields. So we could have seen that on the X-ray. We could see that the lung or vascular markings were appreciable. There was no obvious rib fracture on the X-ray, and also the oxygen saturations are normal of this patient. So pneumothorax as a possibility was ruled out. What actually is pneumothorax? Pneumothorax is the presence of air or gas in the cavity between the lungs and the chest wall that causes the collapse of the lungs. So main cause of pneumothorax is collapsed lung can be caused by an injury to the lung, and injuries can be a gunshot wound or knife wound to the chest, rib fracture, certain medical procedures. In some cases, a collapsed lung is caused by air blisters of the lungs, which we call as bleps, that break open and that cause air to get accumulated in the space around the lung. What are the three signs and symptoms of pneumothorax? So basically, collapsed lung or pneumothorax leading to collapsed lung, there would be sharp stabbing chest pain that worsens when trying to breathe in, shortness of breath, reduction in oxygen saturation, bluish skin caused by lack of oxygen, rapid breathing, and fast heartbeat and cough. So none of these were present in this patient, and this was the sinister condition which needed to be ruled out. So what is the most likely diagnosis given the history for this patient? We have seen that the X-ray shows elongated tubular shaped heart, the lung fields are large, diaphragm is flattened. These are the findings which are suggestive of COPD, chronic obstructive pulmonary airway disease. COPD has got two types. One is chronic bronchitis that usually takes place in smokers, and the other is called emphysema, which may take place in smokers or non-smokers. So chronic bronchitis is out of the question in this patient as he doesn't have any history of smoking. Most probably in this patient would be emphysema. And given the fact there's no risk factors, no occupational or otherwise, most likely in this patient would be familial emphysema. We'll talk a little bit more about that in the next slide. So what is emphysema? Emphysema is generally caused by cigarette smoking or long-term exposure to certain industrial pollutants or dusts. A small percentage of cases are caused by a familial or genetic disorder called as alpha-1 antitrypsin deficiency. This patient seems to have alpha-1 antitrypsin deficiency, or most likely congenital or familial form of emphysema, since there is no risk factors such as smoking history or industrial pollutant exposure. So what is COPD? Emphysema and chronic bronchitis, which is another lung condition in which there is persistent cough with production of phlegm, are both features of a common lung disease called as chronic obstructive pulmonary disease, COPD. Emphysema is generally caused by cigarette smoking or long-term exposure to certain industrial pollutants such as dust. A small percentage of cases are caused by familiar or genetic alpha-1 antitrypsin deficiency. While damaged airways do not regenerate and there is no cure, emphysema is preventable and treatable. What are the symptoms of emphysema? The symptoms of emphysema include breathlessness with exertion and eventually breathlessness most of the time in advanced disease, increased susceptibility to chest infections, cough with phlegm production, fatigue or weakness, barrel-shaped chest, which takes place due to expansion of the rib cage in order to accommodate enlarged lungs, cyanosis or blue tinge to the skin due to lack of oxygen. So this concludes this slide regarding the case history, and we'll meet you soon in the next one. Thank you for watching.